Our comedian and actor Richard Lewis died yesterday at the age of 76. Today we are learning more about his cause of death.
And we're also learning more about his health history as he battled multiple issues over the years before his death. And joining us in studio to talk more about this is Fox 5 medical contributor Dr. Richard Chaffoo. Thank you for joining us.
Sure, good to see you both.
You know, he died from a heart attack. Can you explain the mechanics, I guess, of a heart attack?
So Maria, his underlying neurological disorder, of course, was Parkinson's disease, which after Alzheimer's is the most common neurological disorder. And heart disease is the biggest killer globally, but they are connected because patients that have Parkinson's disease have something called autonomic dystonia. Our autonomic nervous system controls a lot of things, the cardiovascular system, and so there are disruptions in that. What happens in Parkinson's disease is there is a depletion of dopamine in our brainstem, and dopamine is one of these central neurotransmitters that's part of our autonomic nervous system. So people with Parkinson's typically suffer from cardiac disease. They may have arrhythmias, and that certainly could be cause of death. But because it affects overall the cardiovascular system, they can have congestive heart failure, they can have structural changes in the heart. So there is, and also there is an association between Parkinson's disease and diabetes, which we know is a much higher risk for heart disease. So it's probably a combination of those factors. There's a higher risk of hypertension for the same reason, because there's a disruption in our autonomic nervous system.
Is there a treatment if somebody is diagnosed with Parkinson's? They say, okay, we're going to be proactive and we're going to give you X, Y, and Z to try to prevent these things from happening.
No, and that's a great point, Andrew. Yes, there is, but unfortunately, almost all the medications that are used to treat Parkinson's have cardiac potential toxicity and risks as well. And remember, many of these people are on these medications for many years.
Yeah.
And so obviously, one of the things we talked about before is new research being done in medicine to try to create drugs that have very limited side effects that are more focused on the disorder at hand.
In 1994, he actually almost died from alcohol poisoning. How does that affect him, I guess, at this point?
So, yeah. So
in the future,
Right. So of course, another health issue, it's an epidemic in our country, is substance abuse, right? So part of this is alcoholism. And the issue with alcoholism is it's a multi-system organ, so it affects the cardiac system, affects the neurological system. And there are issues with our liver and liver enzymes, our clotting factors. So all these work hand in glove together. And people that have a higher risk of substance abuse from alcohol are at a higher risk for other substance abuses, which unfortunately I think we're part of his histories as well.
Yeah. Before we talk a little further about heart, Michael J. Fox infamously, unfortunately, has had Parkinson's for a very long time and is very physically affected by it. It didn't seem like Richard Lewis necessarily presented in the same way. Is there a spectrum of the way it affects you?
That's exactly right. There is a spectrum depending upon the age of onset and the extent of dopamine that's been depleted in the brainstem. So there's a whole wide range of, from small tremors to rigidity to loss of balance. It can be really literally all along the spectrum. It can be sometimes very difficult to diagnose very early on.
We do have this one extra day of February, and it is Heart Month. So yeah, let's talk about maybe just some reminders for people out there, because you're right, it is the +1 killer.
It is
the number one.
Some of the signs
we don't really talk about it like we talk about other things.
It is. So I mean, some of the signs that people will have, the classic signs that we talk about, the chest pain, the crushing pain, the numbness going down the arm or into the neck, the sweating, all of that, those are sort of classic symptoms, but there are more benign, if you will, symptoms where a patient may get a heart attack in a certain part of the heart, and it's more like, well, I just have some indigestion, and they kind of blow it off. It's not really that bad, or it's just with overexertion. Diabetics, obviously, higher risk for heart disease, and also it tends to be more of a silent heart disease, so they may not have symptoms associated with it. But the obvious things are, being careful what we eat. We talk about this a lot, avoiding the saturated fats, eating foods more, if you're looking for a protein source, that are leaner sources that are not fatty, fruits, vegetables, reducing our carbohydrates, and reducing our sedentary lifestyle. That's an easier thing said than done, and we're all, and myself included, are also guilty of that, because we do have a relatively sedentary lifestyle. So it's really making that effort to get out, to exercise, and making some small changes in your life. Stopping the smoking, limiting the alcohol content, trying to reduce stress in life. Of course, easier said than done, and looking at your own family history. Are you at high risk? Is there a family history of heart disease? Do you have diabetes? Have you checked your blood sugar? Do you really know what your labs are? Because many times patients will be asymptomatic until they have a heart attack, or they may, pass off the symptoms, like we've seen even with diabetes. So again, it's being your own best patient advocate, trying to take care of yourself, reading, finding out what are things that I can do proactively and preventatively to reduce my risk for developing a heart attack or developing some of these illnesses.
Yeah, we do a lot of things reactively, but it's good to think
unfortunately,
forward, see
yes.
the doctor, get those labs done.
Yes.
Type 1, type 2, which affected the same for diabesis?
Yes. Yeah, so I'd say probably more obviously for type 1, insulin-dependent diabetics, it tends to be more. But in medicine, I always tell patients,
I know.
Medicine is an inexact science. So there's nothing. It's not like physics. Not every patient's the same. But be your own best advocate. Go to see your primary care doctor. Get those tests done that you need to get done.
Important.
Yep. Dr. Chaffoo, thank you so much.
Sure.
Great insight. Appreciate it.
Thank you, Dr. Chaffoo.